transmit nerve signals. They bind to specific receptors that initiate action in the cell when stimulated. Sedative hypnotics in particular enhance the neurotransmitter GABA by binding to GABA A receptor sites. Some of these drugs are also barbiturates, which I covered under the sedative class, that also enhance GABA activity. Then for the treated patient symptoms/use, when are sedative hypnotics used? They can be used for a variety of situations, including but not limited to treatment of insomnia to induce and maintain sleep, commonly prescribed for sleep disorders, and occasional sleeplessness caused by mild to moderate pain, anxiety relief, pre-procedure sedation, mainly with sedative anesthesia. It can also be used to initiate a barbiturate coma, which is a medically induced coma. Then it is also common with non-24-hour sleep-wake disorder, which is a circadian rhythm sleep disorder, more common in completely blind people who cannot perceive light. But these drugs are used to help get them onto a normal amount of sleep and a normal schedule. Then it can also be prescribed for the Smith-Magenis syndrome, which I've never heard about before researching, but it's a rare genetic disorder that causes many cognitive and behavioral abnormalities, including sleep disturbances. They can also be used for shift workers, where you work the nights and you may have difficulty processing your circadian rhythms. These drugs can be useful for establishing a normal sleep cycle. And the expected outcomes of this drug, there are three main ones. There's a lot of different uses, but overall, they help for improved quality of sleep, sedation before procedure, relief of anxiety, along with a myriad of other outcomes. Then for common side effects and precautions, for the side effects, they can induce drowsiness, neuromuscular and skeletal weakness, ataxia, which is impaired coordination, balance, and speech, lethargy, and depression. Then there are a lot of other side effects that I didn't include in this presentation. So if you are thinking of taking a sedative hypnotic, consult with your doctor, and you can go on to the FDA to look up specific medication, look at all the side effects, indications, contraindications. And also for precautions for taking this drug, barbiturates and benzodiazepines have the potential for abuse and should only be used as prescribed, and their continued use can lead to physical dependence, and when the use is lessened or stopped, they can induce withdrawal symptoms. Because all CNS depressants work by slowing the brain's activity, mainly with the GABA neurotransmitter we talked about, when an individual stops taking them, the brain's working can rebound and race out of control, possibly resulting in seizures and other harmful consequences. So it's very important to stop taking the drug as prescribed by your doctor, just because the effects of a sudden stoppage in the medication can be serious. Then you should also not take the drug when you are pregnant, because the drug has the potential to harm the fetus. For toxic effects, I briefly touched on this, but there is a significant increased risk of respiratory depression just because it is a CNS depressant, and oversedation and accidental overdose can lead to death. Long-term use of benzodiazepines is also associated with depression, cognitive impairment, increased rates of motor vehicle crashes, increased rates of falls and hip fractures, and increased rates of mortality. And these medications are also associated with memory impairment and can affect the ability to safely operate motor vehicles and can increase the risk of falls. They have significant risks for respiratory depression and even death in combination with other CNS depressants, including opioids and alcohol. I feel like I keep touching on these same topics: respiratory depression, falls, respiratory dependence, just because I want to reiterate how important it is to be aware of the side effects, the interactions, the contraindications before starting this drug. Then To determine tardive dyskinesia and extrapyramidal symptoms, you can use, I don't know if this is blocking it, but you can use the Abnormal Involuntary Movement Scale, also known as AIMS, and AIMS evaluates symptom severity across 12 items. I put a table here that shows the 12 items that are being looked at, but items 1 through 7 assess the severity of involuntary movements across body regions. Item 8 is based on the highest single score of items 1 through 7 and may be used independently as an indication of overall severity. And items 9 and 10 assess the impact of TB and may be useful in clinical decision making. Then items 11 and 12 assess dental issues. Then it wasn't included in our rubric, but I did want to include alternative therapies to sedative hypnotics. Because if you are concerned about developing a dependency on sedative medications, talk to your doctor about alternatives. Antidepressants like SSRIs can help treat anxiety or panic disorders, and stress reduction techniques can help, such as exercise, meditation, and aromatherapy. I believe this applies not just to sedative hypnotics, but also to antidepressants and other CNS depressants, because it's always good to focus on lifestyle modifications before pharmacology. Another thing that people can do before taking this medication is try to practice good sleep hygiene. So go to sleep and wake up at the same time every day, and don't use electronics close to bedtime. And if these lifestyle changes don't help you sleep, or if you have other disorders such as the genetic conditions we talked about, or if you're just not able to maintain a certain routine, like if you're a shift worker, talk to your doctor about taking supplements such as melatonin or valerian root. Then here are my works cited. Thank you for listening, and I'm glad to give you an overview on this drug. How do I stop?